Physio. You want your cloth?
Yes, please.
Yes. You ready? I'm trying to be daddy.
Sorry. Yes.
What's the name? Yes, have a seat.
Take it in.
It didn't work. Don't worry. Your ankle's a bit puffy, a bit swollen. Oh, is it okay? All right. How was your weekend? I know you're feeling all right.
Yeah, it's just been unbelievable. Just my oldest daughter from Uganda.
Nice to meet you. Nice to meet you too. Your mum was great on her visit. Amazing. What day was that? That was the second. So you did it on the first, which was Wednesday.
Yeah, so the week today.
The week today. So you're on your baby aspirin,
Mm-hmm.
taking the naproxen.
Yeah, all the tablets that was given.
And the you're on tramadol, 500 mils,
Right,
twice a day.
Twice a day.
Pill.
Yes. The
Fine.
Tylenol, fine.
Bowel movement.
The bowel movement, it's like it kind of ceased, but then we did the
Still soft.
and
Plenty of water.
yeah, so I'm fine now.
Good.
Yeah.
While you're on the tramadol, you'll probably need the stool softener.
Okay.
Or you might need not as much, but you might need
Right.
some.
Right.
Just keep an eye on that, because nothing worse than being uncomfortable.
Yeah. So
Let me wash my hands. I'm getting a bit of sleep.
yeah, I'm just waiting for the
For the pain?
yeah.
I think I've had this discussion with Dr. Peckett years ago. I said, why do some people do well and some, knees?
Right.
And all we can come up with, when you're in a lot of pain pre-op, this pain is nothing.
And so maybe that's what
It's
it is.
relatively, it's
Yeah.
like, yeah, it's sore, but it's not that pain.
Yeah, like yeah.
Because some people, they're in agony, and other people,
Exactly.
I've got my
Because
pain, I've got mine, go a week, It's just, if you walk well, you can.
yeah, I'm just grateful because I was anticipating my nights, being in pain.
Yeah.
But
I sleep in different units are so painful.
yeah.
But the knees are harder
Exactly.
afterwards. But let's have your shoes off. That's it. Can you get your legs up? Wow, good. And lie yourself down. Yeah, they're not bad, but they're obviously more swollen than they look because you can't get in your shoe.
Well, it just felt uncomfortable to
Push.
Yeah.
To maneuver into it.
Yeah. So I was just like,
Yeah, so
And
she
not
said,
too
oh,
swollen.
I'm
You
not.
don't think you see quite a bit of swelling here.
yeah.
Yeah.
I've been doing my ice.
Yeah. And I'm going to take that off today because you're.
Yay!
Let's start with that. Get some gloves on. I'm going to take that off. Usually there's not a lot to see underneath. It's a bit of an anticlimax, which is always better way.
I'm just grateful I don't have clips
I know. You know why you don't have clips?
because Dr. Packett did it. I know. I got the 911 or the 411.
I told you about
Yes.
the patient. Yeah.
So,
I haven't seen a clip since.
Oh wow.
And that's a year.
Okay.
Yeah. And it was amazing. He did it because it was quick.
Right.
And Dr. Peckett just takes the time.
Yeah.
All right, let's have you on your side. So you probably want to bend your knees, keep that pillow between them, and just take your time. It is a narrow bed.
Okay. Cool.
Maybe not. Too uncomfortable?
Yeah.
Okay, you stay there then.
This is the part I wanted to see.
It is. It's how you do it. And yeah, fair enough.
I feel
Where do you
good.
feel that?
In my butt cheeks.
Excellent, right place. Bend your knees a little bit more. That's it. And again, lifting up. This one you can try on your bed, but it's a little harder because it's not as firm. But if you can do it, great. But if not, don't worry.
And should the bed be flat, flat, or like how you got a little
Oh,
arch?
you can have a head seat more.
Okay.
But you can do any breathe, you can be flat.
Right.
That's good. Getting tired?
Okay.
Getting lower and a rest. And rest. It's not good to not get as high. Alright, you can put your head flat. Stop taking big steps. The leg stops going behind well, and you stop stretching that hip flexor around, leading up to the time of surgery. So then lying flat. It's a bit tight. Is your leg okay?
My head's fine.
Is your leg, isn't it?
Yeah, right in,
yeah.
in here.
Right, yeah. So this is really where your leg works. Lying flat on the bed. So you want to be your head. Head can have the support. But you'll have to sort of gradually, so you might do 30 seconds a minute, and then you bend your knees up and have a bit of rest, and then you come down again. But this, if often pre-op, but also post-op, you find people stoop.
Right.
Because hip flexors are tight and a walker and a walker. If you can't get flat in lying, you're not going to get upright in standing. So this is a sort of, it starts to get you straight before you get onto that walking stick and then help to get you upright. And many people are stretching this muscle out weeks after their surgery because they've got so tight for so many years. So this don't think, oh, I've got to do it this week. No, you can do what you can. And that's really killing your mind, chatting away, making you do it. Then you just bend that knee up, oh, I feel so much better. You get it every day.
Yes.
But through the day, you might do a minute or two. You might pick the time that you do it. After meds, not too late. When you've had a walk, you've warmed up a bit. But definitely that is just,
Yeah. It felt good though.
yeah, it feels like it's stretching. Yeah. Now as you get better, bend your good leg up. Does that give you more of a stretch on this side, or is it okay?
It's okay.
Yeah.
Yeah.
Is that your left or your right hip complaining?
Yeah, this one.
Yeah.
This one, I feel like it's working it.
It is, it's
Yeah.
stretching it more.
Yeah.
But I don't know that one. That one's going to do some work over the next few weeks.
A good bad
You're good
leg.
about that. Is that one on the edge of foot towards me? Lovely.
Yeah.
This is much easier.
How is the head me working this one?
Oh,
I've been
it's so
working.
much better.
I've been working it by myself too.
Oh, it's good. You just need something to cut the friction.
Yeah.
Like a plastic bag or a hand, isn't it? Oh, that is good. And your blood thinner is baby aspirin, isn't it?
Yes.
Twice a day.
Yes.
This is excellent. I mean, this one's having a little rest. Can you do that one?
And take it out.
Because you might as well do a little bit of prehab while you're there.
Yeah, right.
So, and this one needs a breather in between sets.
Right.
So, yeah, whatever we do for this one,
We do for the other.
do for that because you're gonna, if you go in stronger,
Right.
all the better. But not to pain, because again, it needs to hold you up for the coming weeks. Now, if you bend your good leg, can you lift a straight leg up? That's better than a week ago. Actually, 6 days ago. That's hard. It takes a few weeks to master. There we go. Tighten your toes up towards you, and then lift. There you go.
Oh.
In the hip.
And it's actually in my, like, groin.
Yeah, right.
I mean, I feel it in the hip, but
It's the muscle.
Yeah, muscle.
So bend this knee up. And now straighten this knee. Hold it there, keep it there, keep it there. Good. And then bend your knee. A little easier.
Yeah.
And again, straighten your knee. Pull your toes out. And then the muscles work. And down. And this is when you've probably been doing sitting in your chair, straighten your knee and hold it. And again, now pull your toes up towards you. Hold it, hold it, hold it. And gently down. Again. Toes up, hold, and gently down. Muscles or hip? What's working? Or anything?
Yeah, it's like a combination.
Last one. This one we'll do together. You don't need to do this at your home. And then gently down. But definitely the ones on your sheets that you have already, the bending the knee up, sliding out to the side, lifting your leg over that little roll. Keep
Yes.
doing all of those. That'll make the next step easier.
Okay.
And the bridging, if you can. So let's finish off with 5 more bridges before we walk into the bridges. So you're going to lift up. First of all, bend your knees as much as they're going to comfortably bend. That's it. And then lift it up. 1, go. Gently down. 2. Okay. 3. That's it. And then rest. You get you to stand, you do some exercise standing, and then you try to step. Is your husband still at work this week? Or
Yeah,
is
go back to
go
work,
work?
yeah.
So if you go upstairs to sleep, you're gonna have to have someone with you to come down and then go back up.
Yeah.
So you still might spend most of your day downstairs.
Yeah.
You know,
I think in the first 2 weeks, I would stay downstairs
Downstairs.
anyway.
Oh, okay. So you're not in any huge rush to do
No.
that. Okay, we can wait to do steps. It's fine.
Okay.
If you wanted to do your shower and wait till you go to bed, I'm happy to practice. But equally, if you don't feel up to it, you can.
Yeah, I rented the hospital there for a month, so.
Oh, okay. Well, let's have you standing. You do some points now.
And the chair's working out okay with the cushion?
Well, it is, but I found, well, with the bandage, it was a little uncomfortable
Oh,
for
so
me.
now it'd be interesting to see.
But now,
Does it feel different already?
a big difference.
Oh, good, because they are bulkier.
Yeah.
But equally, the non-waterproof ones, there's a pad of gauze, there's the dry dressing, so
Right.
they're
Yeah, so,
bulky as well.
so I
But we
found,
take them off at day 1.
Right.
When we come and you're left with that from day 1, if
okay,
it's not a waterproof one.
right,
Um,
yeah, but I feel it's such a difference.
You're not sitting on a wallet or a brick.
Exactly.
And you started, so you felt like yourself.
No, that's it.
Take that leg out each side. That's it.
This has been
That's
my
nice.
homework.
That's good. Are you feeling your left hip work?
Yes.
Yeah. In a couple of weeks, maybe sooner, we'll see. You'll start doing this with your left leg.
Okay.
But that means putting all your weight
Wait
on
on
you.
you.
So, not yet. You are in your week. Really happy. Good. And how And you can go as level with your hip as you want to. So don't be afraid of going over that 90 degree. You won't be strong enough to do that.
Okay.
That's it. Not so bad with the left hip, is it?
No, it just cracks. It's not like a tin man.
Come here to the bottom. This is the bottom leg. And that's it tight. So have a just up. And try to swing as you get this down. That's it.
Get the swinging.
Good. And the swing forward is easier than the swing back.
Yeah.
So once you've loosened it up with a few swings, then see if you can just actually get it back a bit further. I'm just seeing this move a little. You'll probably be better holding onto a counter or something.
Got you.
That's it.
Feels good there.
Yeah, just a move. They always feel better to move. Good. And have a rest. We're going to do begin. That's it. All right, have a little bit of this. Bend your knee.
Yes.
That's it. If you can.
Yeah, that always feels good.
Yeah.
That's
And then
my,
stretch that front out a little bit.
that's exercise. That one actually.
Feels nice.
Yes.
No pain in it. Bending your knee, not bending your hip.
Right. There's no pain in it at all.
That's it. So now we combine that exercise with going back. Okay, so you're going to bend and kick back.
Okay.
And that puts your butt in your hamstrings, doesn't it?
Mhm.
That's it. Nice. Get back there, go. Back there.
Okay.
When you bend your knee,
Mhm.
just bend the knee. That's it. Don't bring it forwards, and then take it off my hand. Push back. That's it. And then down. So bend and push away from me. Yeah. Bend. Oh, I hear it.
You're my left knee.
Left
My
knee.
left hip.
Oh, do I?
So like the tin man.
Yeah.
You're waking him up.
My left hip's like, hi, what we doing?
And your left hip might be the.
You're the walker? Yeah.
You ready to let that go?
I'm ready.
I feel like I'm like this then, slightly. Does it feel longer? Yeah. Okay.
That's like remember I told you your butt.
Let's try your cane. Yeah. Do that. Now, look straight ahead for me. Because if you look down, the cane ends up being too short. So look straight ahead. Keep looking ahead. That's better. So you hold it in the opposite hand, which I know sounds weird.
Yeah.
But
Actually, I thought.
I know, 50% of people think that. If you put it in that hand, you'd lean all your weight onto your left leg
Got you.
when it does need to take the weight. So when you lift your right leg, left leg, that's it. Or just walk. I think you're fine. And then when you get to turning, just pick your feet up and turn to your left if you can remember that. And that's the safer way to turn. But if you turn right, it's not the end of the world as long as you do it twist. Okay. How do you feel?
Your right hand looks like you don't know what to do.
Come and walk closer to the bed. So you can touch the bed if you want to. Just give that little bit of confidence, which is what you can do in the house.
We'll just have you walk next to you every time you use the cane. It's gonna be like my horse is going.
My grandson's been using the cane as a horse.
Oh, I see. Oh, dear. How old is he?
3.
It's more work, it's more tiring, but you're safe to walk with it if you feel comfortable in the middle of the day. First thing in the morning, end of the day at night, middle of the night, you go on that walker, you're absolutely safe. You don't have to think about walking, you just push that trolley along, you're good. But you're safe.
Right.
When you've been napping, when you've been still.
Right. This is. Yeah.
You'll practice with the cane, and equally if you don't want to, you do a bit more when you're here next.
Well,
I'd rather you use the
cane
cane than nothing at all, which is almost where you're heading.
Right.
Because the walk is too much. How's your hip feeling?
My left hip is working.
Yeah, and that might be the other thing. It might be that your left hip says,
Yeah.
you can't do this, it's too sore. And so you just have to listen. So if your left hip is sore later, don't overdo walking with the cane, just so it can hold you up a bit more.
Yeah.
Our homework is bending your knee
Mhm.
and then taking it back.
Right. That one is in.
And then laying flat now.
And like,
And I
well
feel
done.
like it's right.
Just do it. And just bits and pieces.
Yeah.
It's good.
Yay.
So gauge your pain when you get home.
Yes.
As to how much. And you might do some walking with the cane, but you might do more walks. I need you up and moving right. So I've got to return that walker.
No.
You're not there.
Yeah.
But then when you do it, the stronger you get.
Yeah.
It's just 'cause you're not
I'll
used to it.
stretch your hip next time, which might help with that imbalance, but equally, if it is a slightly longer one, they'll level you off when they do the
The other one. That's what I'll be saying.
Yeah, and I don't normally got a shoe lifted this early,
Mhm.
but if after say a month it still really is, because you know it, because when you
Yeah.
straighten
One
one
knee. Yeah.
the other foot
Totally
comes up.
different. Yeah.
If it's still like that, then we might just put a little wedge in just to keep
Okay.
you comfortable while you wait to get the other one done.
Okay.
But sometimes it is just tightness
Right.
that needs to be stretched
Stretch
out. Yeah. No, that was very good for your first session. Well done. Go home and rest. Don't plan to go anywhere but home after these sessions. You'll be exhausted.
What I did want to ask about what they call a donut. What do you think?
No,
Okay.
why not? I think you're more likely to have a problem getting up and getting down safely.
Okay.
And the hip I don't want.
Okay, so just my pillow that you put in the chair.
Yeah. It's just
Well, mind
uncomfortable.
you, now that I have the bandage off, I'll probably feel more comfortable. Because it was just,
You
you
were
know,
upset.
sitting, yeah.
Oh, it's pretty good.
And it was that.
Yeah.
Okay,
See, good thing you asked. Save
Yeah.
yourself some money.
exactly.
Question, do you guys have more of the socks or where can we get
I
this?
don't. I would think Medical House.
Okay,
I'm not sure if even Dr. Wong's little pharmacy sells them.
which time too?
Or like 2 doors down.
Okay.
But I think Medical House is
Okay.
really going to find them. Or Lighthouse Medical by that time.
And do they come in sizes or is it just
You
like
would think
one?
so. I would think they must do.
Okay.
Yeah. Might have to look on them. There was some writing. Just come and purchase stuff here.
If not, we'll keep running this, we'll just have to wash them.
Wash it and dry them and
Yeah, she needs them on for another week, yeah, he said. No, we just take them once, so that she could breathe till then we wipe her down.
large, regular,
Okay, cool.
size E. Yeah, no, that was easy.
Yeah, right, didn't even think to look at it.
Because I think when you go for pre-op, the nurse measures your legs, so you get the right size 10.
Right, and that's what she, yeah, that's
So they
what
think,
she
yes, they
makes
must be.
sense.
You and I have a bit lengthy.
Exactly.
So I've had a
Even though
long,
these are huge.
yeah, I've probably had a long one, you have a regular one, and someone's really short legs, but you become small.
Right.
Okay, and that's yours, not mine.
Thank
you. And are you set for a couple of weeks for physio?
I have all 6 weeks. Thank you, Jane.
Don't over anything, which is good.
Yes,
Really.
I am.
Yeah, yeah, that's great.
Thank you, Jane.
You're welcome.
Hey, this is stuff I use.
See you next week.
Doing nicely. I'll see you next week.
Sound good to go? You put me in for 6 weeks.
Yeah,
So there's a charge for today?
it is only home visit, but if you want to pay that back to you.
We could do it now.
I have my work.
First physio done, guys.